Hi, welcome back to my channel. In this video, I'll be discussing about the Pontics, various Pontic designs in FPD. So first of all, I have this picture and now we'll just go through the names and then we'll go through the indications, contraindications, advantages, disadvantages and certain points that you should know. So first of all, we'll just name them. So this is the first one and this is our sanitary Pontic. So this is our sanitary, sorry, this is our sanitary Pontic. Then second, this is the saddle or ridge lap. Then we have third, which is conical. Then fourth, modified ridge lap. Then fifth, ovate. And then sixth is modified ovate. Alright, there are others also, but first we'll go through these. So see, now you can see the appearance, right? So now we'll talk about the recommended location of each of them. So recommended location. Now sanitary Pontic has no mucosal contact and it is as you can see in the picture, no mucosal contact, and it is referred in posterior mandible. Now saddle is not used now because it has if you see buccal and lingual contact, right? Conical, it is in molars without aesthetic requirements. Now modified ridge lap is the most aesthetic one. Like most aesthetic is ovate, but this is also preferred. So ovate is not preferred because it requires surgical preparation. So modified ridge lap is the which is the most widely used. All right. So this is highly aesthetic. So this is given in anterior teeth, sometimes in premolars, and sometimes also in maxillary molars. Then ovate, this is the most aesthetic Pontic design, Now this is preferred in maxillary, incisors, canines and premolars. Now modified ovate is same like this as ovate. Now I'll tell you later like why when we prefer modified ovate than ovate, simple. So now let's talk about the advantages and disadvantages. So first of all, in this sanitary, what happens is there is no mucosal contact, so we have enough we have good access for oral hygiene, right? Good access for oral hygiene, but the aesthetics are poor, so poor aesthetics. Okay, now over here in saddle the aesthetics are good. Now in but the oral hygiene is hampered. Okay, then coming on to conical. Now in conical there is oral hygiene but aesthetics are hampered. Then modified ridge lap, basically it has both the things. It is good on aesthetics, and the disadvantage is that it is like moderately easy to clean. Now ovate, the biggest advantage is aesthetics, and the disadvantages, now this comes as an MCQ, so you should know that it needs surgical preparation and it is not for residual ridge defects. Now this is modified ovate. Now this is also important, like the similar, only aesthetics and then good oral hygiene maintenance, easy cleaning. Okay, same over here also, right? Now let's talk about the indications and contraindications. So indications and contraindications. So first we have the sanitary Pontic. Now indications is basically non-aesthetic zones, because you can see it is not aesthetic, or when there is impaired oral hygiene. Now it's not given, although, okay. So contraindication will be where aesthetics are required and where there's minimal vertical dimension. Now saddle Pontic is not recommended only. Then we come to conical. Now in conical, indicated in posterior areas where aesthetics are of minimal concern and contraindicated in poor oral hygiene cases. Then modified ridge lap. So in aesthetic areas it is indicated, and where minimum aesthetic is concern is there it is contraindicated. Okay. Then coming on to ovate. Now ovate is also indicated in when there is optimal aesthetics are desired and when there is high smile line. Now it is contraindicated if patient is unwilling to undergo surgical procedure, and it is also contraindicated in residual ridge defects. Now I'll tell you where this modified ovate is indicated. Now this is important. Now modified is indicated in where the horizontal ridge width is insufficient for ovate Pontic. There it is given. Okay. Now same in contraindication, same unwilling to go through surgery. Then coming on to the materials that you can give along with this. So the materials that are preferred. So in first one, which was our sanitary, I will just do it like this. So in sanitary we will prefer all metal, and this is not applicable only. Over here in conical you have metal ceramic, all resin, all ceramic. Now in all others similar is like all these three will be preferred. Now I'll just give you certain points that are important for MCQ basis. So see, first we had the saddle, then we went on to ridge lap. Now I'll just enlist some MCQ important points. So one liners. So first of all, in ridge lap the contact is only on the labial surface, just only tissue contact. Okay. Then what is lap facing Pontic? This is further reduced version of modified ridge lap. Okay. Okay, then in certain points about modified ridge lap. Now here there is slight buccolingual concavity, and basically it is just limited to the labial contact only. And most important question that they ask is T-shaped tissue contact. So it is in modified ridge lap tissue contact. Now ovate is further of many types, so I'll just talk about them here. Ovate. Now modifications. So first is modified ovate, then is root form, then is natural tooth Pontic, then is Landsberg Pontic. Okay. Now let's understand. So in modified ovate, it is similar to the normal ovate, but the similar except gingival convexity is in a more labial relationship to ridge. Then root form, basically it restores the portion of tooth and root in patient of gingival recession. Natural tooth Pontic, basically to replace the crown of extracted tooth is used. Then Landsberg, in this you have broad base and used for socket shield surgery. Okay. Then we have certain others also, like we'll discuss them. over here. So I'll write them here. So you have spheroidal and you have modified spheroidal. Okay, so this is also known as egg Pontic. Now they contact tissue only buccolingually or mesiodistally. There is no concave gingival surface as you saw in modified ridge lab. Okay, and then these are used in cases with reduced interart space. So indication used in cases, sorry, let's try it again. Used in cases with reduced interarch space. Now over here in conical, I want you to know that it has certain names also, like it is also called as heart shaped Pontic, then bullet shaped Pontic, dome Pontic. Now the others are, we have bar sanitary Pontic, then there is fish belly Pontic, fish belly or conventional Pontic. Then we have barrel or arc FPD. Now let's understand. So over here in bar sanitary, basically you have some situation like this, and here you have the tooth. So like this is the thing. Fine. Like this. So this is when minimum distance between ridge is 3 mm. Okay, it's also called as sanitary or wash through Pontic. Wash through Pontic. Now fish belly is something like you have this and then you have this. So you have rounded facio gingival and linguo gingival angles. Then in parallel Pontic you have something like this. Right. Parallel Pontic you have. So this is basically arc FPD, and this is basically characteristic is hyperbolic or paraboloid shape. Now this is 2 mm, okay, height. So this completes all about Pontics that you should know. So if you found this video helpful, do give it a like, share, subscribe. Thanks.